audience, we are going to start an exclusive urban health policy dialogues with David Nabarro. And today's topic is urban health multi-sectoral partnership and sustainable development in regards of COVID-19. I'm sure that you all know about David Nabarro, but I'm just introducing him with you. David Nabarro was a lecturer and he started his career in nutrition and public health at the London School of Hygiene and Tropical Medicine in 1982, and he was up to 1985. Then he was the senior lecturer in the health system at the Liverpool School of Tropical Medicine from 1985 to 89. Then he joined in the United Kingdom Government Foreign Office as a Overseas Development Administrator, as a Senior Health Advisor for East Africa from 1989 to 90, and Chief Health and Population Advisor from 1997. He became the Director of in the UK Department of International Development from 1997 to 1999. In 1999, David moved into the United Nations system, starting as an Executive Director at the World Health Organization, responsible for the Rollback Malaria Project and the Office of Director General. He was the special representative of the WHO Director General for the Health Action of Crisis from 2002 to 2005. He was then appointed as the UN System Senior Coordinator for Avian and Pandemic Influenza from 2005 to 2014. United Nations Secretary General's representative for Food Security and Nutrition from 2008 to 2014. As a coordinator of the movement of scaling up nutrition, he did work from 2011 to 2014 as Assistant Secretary General. David is currently working as a co-director since mid-2019 and the chair of the Global Health at the Institute of Global Health and Innovation, Imperial College of London. For the Swiss-based special enterprise of 4SD Skill System and Synergies of the Sustainable Development, established in 2017 and training and mentor leaders of the Sustainable Development. Since June 2018, David has curated the Food System Dialogues as a contribution to the transformation of food system. They have involved more than 1,700 leaders in 29 locations within the last 14 months. From July 2018, David contributed to preparation for the UN at the September 2019 Climate Action Summit. David co-facilitated the coalition and the advance of nature-based solution work stream China and New Zealand. David is co-chair of the Forum of the Climate Change and Health, which will complete its work at the World Innovation Summit for the Health, November 2020. From March 2020, David is appointed as Special Envoy of the WHO Director General on COVID-19. And lots of things we can talk about David, and I think that it will take a long time to introduce him. But I know him from 2011. And I'm grateful, David, that you joined with us. I think this will be a very exclusive for Bangladesh due to we have been going through a critical situation related to the COVID. David, let's start with the question that what is your plan and understanding about the urban health system of developing countries, including Bangladesh, as COVID-19 is appearing as an urban infectious disease?
Thanks very much indeed. Firstly, I want to say how delighted I am to be working once again with you, Shamim Talakdar, and colleagues in Eminence, and through you, colleagues focusing on health in Bangladesh. This is really important to me. You described my career, and I suppose the thing I have to say to everybody is that I don't see my career as following any kind of linear path. Instead, I had the good fortune of doing a number of jobs in the international arena, which enabled me to pursue the values that I've had since I started out in medicine. And these are the values of public health, the fact that each life is of value, and that there should be no discrimination on the basis of where people come from, on the basis of who they are, on the basis of how wealthy they are. And I've never had a different view of what matters in life, but it's been great to have been given roles which have enabled me to pursue this value system. And now that I've left the United Nations, I am more and more focusing on what is needed as we look ahead in terms of styles of leadership and the execution of those styles. And that's what I'm concentrating on in 4SD, the organization that we talked about, and also what I'm concentrating on in my engagement on COVID or on food and nutrition or on nature. And so that brings me to my second point. I don't believe that any one individual or any one body of science is going to chart the path for the future. I think that because of the way in which all aspects of human life are interconnected and the way in which power differentials between people determine the extent to which we can be active, my total preoccupation for the future is on how groups of people can work together rather than work in competition with each other, because I have come to the conclusion that collective action is the key to the future. Now, to your question, working in urban settings is so powerful because of the proximity of different actors and the fact that in that space, not only are they physically close, but they interact on so many different levels. And for me, operating in the urban space provides real opportunities for advancing health and equity through the Sustainable Development Agenda. And to my last point on this, I think whether we're focused on shelter, on food and nutrition, on employment, on access to water and sanitation, or human rights, and all other issues that are in that space, I do believe that the experience in urban communities, especially when that is shared between urban areas, is so powerful, particularly on interdisciplinary working and stakeholders together. So I just want to really stress to you that in my judgment, urban action is very much going to light the path for moving forward on many of the challenging issues of our time.
Thank you, David. As you agreed that there is an important needs for the urban perspective, but I shared with you earlier that if you look at that in Bangladesh, like we don't have primary healthcare service, strong primary healthcare service in the urban areas, though we have a very it's a good healthcare service at the rural areas. So in terms of that perspective, how UN system, donors and others are thinking to strengthen the urban health system after or post-COVID period, as well as during this period for the developing countries like Bangladesh?
Thanks very much indeed. I mean, COVID really stimulates two kinds of thought and action in my mind. The first is that this is a new zoonotic virus, which is extremely dangerous and which spreads very easily across populations. Many aspects of its pathogenesis, if you like, the way the virus causes disease, plus many aspects of the impact of the virus are still being found out. And so I ask everybody, do not underestimate it. Treat it seriously and make certain that we have strong public health capacity everywhere to be able to hold this virus at bay. Public health capacity is not necessarily hospitals and health centres. It is the ability to undertake surveillance of people's health in their local communities, place-based, regular, people-centred surveillance. But to do that, investing in local level public health capacity is the key. Now, that's not programs to deal with particular diseases. It is the capacity to keep a watch on people's health in relation to any particular kind of illness, whether it is communicable or non-communicable. And just investing enough in public health is going to be a key requirement for the future. And assessing what that level of investment is becomes really important. So that is the first point. We're not able to advance economies and societies without a much stronger investment in functioning public health capacity everywhere. This is going to be a really tricky thing because people understand the importance of investing in security, and they put in security into airports, or they create police forces who maintain security in the locations where we live. But we need the same focus on health security, and that health security means not just communicable diseases, also non-communicable diseases. So raising the level of priority to public health is so important. And the second part is combating inequity, that this particular virus does have such bad effects on poorer people and poorer communities. We see it all over the world. In UK, for example, people who are working in factories, who are low paid, who can't afford to take time away from work and turn up for work even though they're sick, whether they're working in cold food processing plants or in garment manufacturing plants, they are at high risk. But they're at high risk because of inequity, because they need the resources, because they're poor. So COVID will not be dealt with without focusing on inequity. So that brings us to two key things that COVID's going to require us to do for the foreseeable future, which is to combat inequity and to invest in public health capacity. These are significant, and they apply to every single country in the world. And I believe we're only just starting to understand what this means.
Thank you, David. As you have experience to develop the health system all over the globally, you did lots of work in different countries, especially in Africa too. Can I ask you that, as you mentioned about communicable and non-communicable disease, as I have experienced in Bangladesh during COVID, like diabetics and cardiac patients were out of any type of services. They didn't get any services. And when you look at that mortality cases in Bangladesh, you found that every single case had the comorbidity like diabetics or hypertension or cardiac diseases. So I think that this is important to restructure of the health system to act this type of diseases or pandemic situation. What is your suggestion? How developing countries should restructure or manage their health system to respond to this type of pandemic situation?
Thanks very much indeed. During the first half of 2020, many countries responded to the virus by really imposing major blocks on economic and social activity. More than half the world was living under some sort of lockdown. And lockdown certainly does slow the progress of the virus. And we saw, therefore, that the doubling time of outbreaks during the lockdown period was increased from 2 or 3 days to about 12 or 15 days. So a lockdown slows the spread of disease, but it also has really damaging social and economic consequences. So it is completely untenable for the world to try to deal with this virus through lockdowns. All a lockdown really does is to buy you time while you then put in place the necessary public health capacity so that you can constantly interrupt transmission and suppress the disease as soon as it appears. And that capacity for interrupting transmission and suppressing the disease is what is going to be needed in every society, everywhere. So my goal is that the world is able to deal with this virus without lockdowns or shutdowns. To do that, we have to make certain that we can keep things going even though the virus is a constant threat. That means putting defenses in place to deal with the virus, but it also means establishing plans for maintaining essential services, even though they are functioning amidst the COVID threat. And perhaps the central of the essential services that I want to highlight is healthcare. And what I would like to say for all health professionals is that we now have the big challenge of maintaining healthcare during a threatening time when the COVID virus can be coming back and affecting us at any moment. So that means investing in making all our health services COVID ready, protecting all the staff as much as we can, and at the same time, making certain that some institutions or some parts of institutions have adequate protection against the virus and can be used for care for people with the COVID. Others are designed for care for people who've not got the COVID, and creating a clear separation between them and as much infection prevention and control as possible. It will take us time to work these systems out, but I believe it's really important to do so. We cannot, I think, plan for a future where routine healthcare is stopped because of COVID. The consequences for children, for women, and for men will be absolutely awful. So it's part of my basic view that as humanity, we learn to do both, live with the COVID and provide the services that people need that are essential for their well-being.
Yeah, thank you. Thank you. We have to accept that COVID is a part of our life and we have to move forward within this situation. As you mentioned about that economical perspective of the COVID, that is important, and our understanding is that it may have an impact of income generation for the lower economical group of the people in developing countries, as well as we see that at this moment lots of middle class are also in the problem of economical problem due to their losing their job. So my understanding, and Bangladesh National Nutrition Council recently they did a impact of this COVID on the nutrition, and they assume that it may go back at the status of 2011 or 2014 status due to this economical impact and access to food. So what is your understanding that how COVID is going to impact on the nutrition and access to food in developing countries?
No, thank you. Of course, we don't have precise data being collected in real time as it's happening, but many experts like yourself are telling me that they are seeing already impacts of COVID as well as impacts of measures taken to contain COVID on the following. First of all, people's incomes, particularly those in the informal sector or on daily wages. they've had a sudden and substantial income drop. We here are managing to find ways to pull back and get their income up again, but it's been a big shock for poor communities everywhere, and the same, I believe, applies in Bangladesh. With that increased poverty, there's also been decreased purchasing power for food, particularly nutritious food, and so I'm hearing reports that household members, and particularly women, have been affected by this income loss. And so you've got poverty, hunger, and malnutrition coming together. And that has become both acute because of the job losses and so on, but it's also long-term because there is shrinkage in economies of most countries in the world. Taken together, I am seeing a really massive increase in poverty, a massive increase in the consequences of poverty, and I see this as quite long-term. What does this mean? It means that really in dealing with the current situation, every nation in terms of social and economic policy needs to have a strong focus on protecting those with low incomes, protecting those who have limited assets, not just from the immediate threat of poverty, but the long-term implications of this poverty. It is a crisis. It is not just a crisis, it is the crisis, and it's the biggest social and economic crisis that I have ever known in my life. And I think it has the potential to last for considerable amounts of time, and therefore all development policies have to be focused on the inequities that are associated with this virus and the containment strategies. Shamin, I think you've gone. I think that I can't see you on my screen. So what I'm going to do is to continue. I just ask if anybody who is on the Zoom screen would wish to, please come in. Otherwise, I'm going to just go on because I've got a number of other points that I'd like to add. And if anybody else wants to make any comments, please enter into the chat or come in through some other method. You see, as I look around the world and I look at the numbers of cases being reported each day, I see graphs all the time that show continuing rises in the numbers of cases reported to WHO. I also know that this is an underestimate of the total. This virus is continuing to advance across the world, in Southeast Asia, in Africa, and in Latin America. And so with this constant expansion of the virus, I also, hello Shamin, welcome back. I'm just given some additional remarks while you were reconnecting. And I just want to say that my analysis is that we're still at an early stage in this pandemic. The virus is now getting established all over the world. It's becoming endemic. And humanity is learning to live with this virus. We're learning about the measurements that we need to make to decide whether or not our response systems are working. We're learning about the strategies that are most successful in the comprehensive effort to hold the virus at bay. We're learning about how to give the responsibility to people everywhere to take control of this virus and not to let it be in control of us. And I'm saying that this is an issue for around 7.6 to 7.8 billion people in our world. And I'm saying we need a worldwide campaign on COVID, not to let it dominate us, but instead to make certain that we're all on the same page when it comes to getting ahead of this virus and the campaign wouldn't be led by the usual world leaders. I mean, we've watched them and some of them have struggled a bit. The campaign should be led by practitioners in towns and cities, in villages and communities, that the practitioners who've been working with local people on coming to terms with this virus and what it means. Because we have to go on living. We can't stop our lives. And it's learning to live with this virus that's the key. And the people who will do the learning are the people in society who are already dealing with many other threats like poverty and violence and like inability to realize their rights and constant harassment. Well, the virus is another source of harassment and difficulty. And the people who are already struggling and struggling effectively at dealing with other stresses can be the people who help all of us learn what it takes. I feel immense and nervousness about telling others what to do on this. And I feel very inspired when I'm talking to people like yourselves who are connected to so many activists who are working for community empowerment. You tell us what you believe people like myself must do to help the world to get better ahead of this virus. Back to you, Shamin.
Yep, thank you, David. I feel that as you mentioned, that there is a campaign is needed in terms of translate the scientific language to the people, to the policymakers, as well as community leaders to understand the impact of the virus, to give the message for the people to live with this virus and how they can operate their economical day-to-day activities. That is important, and we'll be happy to work for our government, work for UN system and our global initiative to do something for the people at this moment. David, I think that we're also a little bit interested to know about 4SD initiative and how you are doing work for the people with COVID and for COVID management in different countries.
Thank you. Each day I am collecting together information about how different nations and subnational jurisdictions and communities are dealing with this threat. I see my job is to offer them ways of framing the issue, what I call the narratives. I see my job as connecting people with each other so they can share. I see my job as offering the science, sometimes digesting it so that it's accessible to people. I'm doing this with others because we're a group of envoys for the World Health Organization. And I'm going to go on doing that. But it's not enough just one person working on their own. This little organization 4SD that my partner Florence Lasben, an economist, and I have set up is an organization designed to establish capacity for what we call systems leadership as broadly across the world as possible. Systems leaders understand that everything is interconnected and that dealing with any one issue on its own leads us sometimes to not take all the factors into account. If we try to do with food and nutrition without looking at health or looking at power relations or looking at shelter or looking at employment, we are not seeing the full picture. Now, there are some who say that to think broadly across multiple disciplines, to be intersectoral in one's working, is too difficult. It's complex because you're having to deal with so many issues. Having discussions with other people is challenging because they have different perspectives. Doing university work is difficult because universities are designed around single specialisms. But in 4SD, we won't accept that. We say, well, if universities function around single specialisms, let's change it because interdisciplinary working is necessary. If governments insist on dividing life up into different ministries and sectors, let's change that and build governance that works across sectors. And if the politics is so rigid that we can only deal with issues in terms of yes or no, plus or minus, let's shift that as well. Let's get a politics that can deal with the nuances and the trade-offs that are necessary in dealing with all issues. And so in 4SD, we offer people the opportunity to learn to be systems leaders and to actually function in the ways that the challenges of today need us to do, especially if we're to create a world that's fit for coming generations. We're not ideologically driven, but we are value driven. We're not aligned to any particular institution or political party, but we are, I believe, relevant to all. And what we do is we have the systems leadership training. We've stopped doing it for now because of COVID, but we keep going and we write articles and so on. We particularly have a systems leadership teacher in our team called John. And then we stay involved in some of the issues that you and I have worked on: nutrition, food, nature and biodiversity, health, gender. And we always look at it from a systems leadership perspective. And I hope that some aspects of it are of interest to you and to others. And if people want to stay connected, the easiest way is just through us, through me, or through what we call 4sd.info, which is our website, because the network and the connections matter so much. This last point: every Tuesday at 5 p.m. European time, every Friday at 8:30 a.m. European time, we have an open session where we take stock of where things are on COVID and on food and other issues. But we also are really interactive. And Shameen, you've joined sometimes, and that's a chance when we can just gently extend our connections and just become more effective at being interdisciplinary and multi-sectoral actors who can bring different stakeholders together.
Thank you, David. Last point I have to ask you: have any recommendation for our policymakers, health manager, and what is your plan to visit Bangladesh? We like to see you, and as if anybody or any organization want to work with 4SD, is there any scope from 4SD?
Yeah. So first of all, I don't think that policymakers have an easy task. They are charged with really making recommendations on how scarce resources are used for the good of the public and the good of the planet. And, Bangladesh is one of the most extraordinary countries. It contains some of the most amazing people in our world who are very, very skilled at dealing with complexity. And Bangladesh's policymakers are skilled as well. You are operating in contested political space. It's not a very tolerant political space in your country. And that's because there is a clear understanding of just how difficult the trade-offs are. and that leads, understandably, to quite a lot of collective frustration, and working through that is never easy. So my comment is that, by and large, although political disputes are understandable, they really undermine our ability to work for the public good. And so the policymakers who continue working despite the really charged atmosphere of competition are really heroic people. And I salute you, and I would like to do everything I can to enable you to continue working despite the stress. And the only thing we can do is to continue to say to those who see life in terms of yes or no and black and white, you know, it's not like that. Life requires constant juggling of conflicting forces. And if we try to simplify it, really we get caught. And so continuing to be able to explain more widely that just breaking everything down into very simple choices doesn't help us. So 4SD will be ready to assist with managing complexity and helping people work through complexity. I want to come back to Bangladesh. Why am I not there? Because I'm kind of, I suppose, busy and travel is difficult. But I don't want to say when, but it's a community and a nation which, from whom I just learn constantly, and with amazing capacity for effective improvisation and finding solutions. And so to come to be with you and to learn is something I very much want to do. And if I come and do that, then it'd also be nice to spend time introducing the living systems leadership approach of 4SD to colleagues. I'm absolutely certain they would find it helpful. Thank you very much, Shamim, for the chance to be with you all. I think I probably will slip off now, a bit later than I meant to be, and I'm keeping somebody else waiting. It's an honor to interact with Eminence and all the Eminence team. I know that some of the work that happens in the civil society space in Bangladesh is not easy work. And I know that you're working on behalf of people who are not always in strong positions, and this also makes it difficult. But I salute you all for what you do, and I have to keep reminding myself that where you are, some of the daily tasks you have to do are so, so tough compared with where I am. Thank you very much indeed for your service and for the chance to be with you today.
David, thank you so much. From my personal heart, as well as the heart from the Eminence and Bangladesh, we are grateful for your time. Discuss with us and guide us. I always, when I first met with you, there is a place you got in my heart. So I always respect you and try to keep in touch with you always. To do some good work for the people. And finally, as a civil society organization, we are now trying to engage some other civil society to develop a restructure of the health system, which will include the risk communication and digital health system for Bangladesh. So we'll do it by our civil society people, and that report will give it to the government to guide them that they can follow that restructuring plan for our country from 2021 to 2041. So that is the plan we have started that work. I'll keep in touch with you and inform you what we can do. And thank you so much again from Bangladesh. Thank you, David.
So bye-bye to all. Please stay in touch. Bye-bye. Thank you.
Bye-bye. Thank you.
Wonderful.